Hello friends, greeting of the day. Welcome to my channel Digital Content Creator. Not to forget like and subscribe to our channel. Today's video is about dengue fever. In this video we will learn about, first, what is dengue fever? Second, causes for dengue fever. Third, epidemiology of dengue fever. Fourth, pathophysiology of dengue fever. Fifth, signs and symptoms of dengue fever. Sixth, treatment and management of dengue fever. And lastly, seventh, prevention and control of dengue fever. So now let's see, what is dengue fever? Dengue fever is a mosquito-borne viral infection caused by the dengue virus, which is transmitted primarily by Aedes mosquitoes, especially Aedes aegypti and Aedes albopictus. It is prevalent in tropical and subtropical regions around the world. Next we'll see, what are the causes for dengue fever? Dengue is a mosquito-borne infection caused by a single-stranded RNA virus belonging to the Flaviviridae family known as the dengue virus, DENV. It is transmitted by different species of female Aedes mosquito, primarily Aedes aegypti, followed by Aedes albopictus, and other species of Aedes mosquitoes. The dengue virus has 4 antigenically distinct serotypes, that is, DNV1, DNV2, DNV3, and DNV4. A fifth serotype, that is, DNV5 has been detected in Malaysia in October 2013. Infection with one serotype does not provide immunity against the others, and sequential infections put individuals at greater risk of developing severe dengue, which is also known as dengue hemorrhagic fever. The disease mainly occurs in tropical and subtropical regions, with approximately 390 million dengue virus infections per year, of which 96 million are symptomatic. With the dramatic increase in the global incidence of dengue in recent decades, about half of the world's population is now at risk of the disease. Now we'll move on to epidemiology of dengue. Epidemiology means distribution of disease and health among population. Dengue has become one of the most widespread mosquito-borne diseases across the world, with incidence increasing 30-fold in the last 5 decades. It is endemic to 128 countries currently, mostly targeting the developing countries. The most prevalent regions include America, Southeast Asia, and Western Pacific, while Asia itself harboring almost 70% of the disease incidences. The highest number of dengue cases globally was reported in 2019. Okay, now let's see, pathophysiology of dengue. Pathophysiology makes you understand how the dengue virus enters the body and affects our systems, organs, causing disease. The pathophysiology of dengue can be understood very well in 4 parts, that is, first, transmission of dengue, second, viral entry and replication, third, immune response, and fourth, vascular leakage. Focus on screen. Now let's move on to the first part of pathophysiology, transmission of dengue. The high-risk areas like tropical and subtropical areas where dengue is common will act as a predisposing factor, and small stagnant water sources to cases of dengue in community will act as precipitating factors for the spread of dengue. Under the influence of above 2 factors, dengue virus is transmitted from one human to other by the bite of female Aedes mosquito carrying dengue virus. Now we'll see second part, that is, viral entry and replication. After the mosquito bite and entry into the human body, the dengue virus replicates. Dengue virus infection primarily targets reticuloendothelial system. The reticuloendothelial system consists of the various cells of the body which are highly phagocytic, and they primarily function to remove dead or abnormal cells, tissues, and foreign substances. Due to dengue infection, reticuloendothelial system of blood, bone marrow, and lymph nodes is affected, which in turn causes production of immune mediators. The production of immune mediators causes activation of immune response and release of cytokines, which in turn stimulates WBC and pyrogens, causing fever-like symptoms to reduce the replication of dengue virus. Now we'll move on to third part, that is immune response. The activation of immune response triggers destructive action of virus or bone marrow precursor cells. The precursor cells of bone marrow give rise to all types of blood cells in human body. Due to virus destructive actions, the precursor cell's ability to produce new blood cells is affected, causing thrombocytopenia, which is a condition of low blood platelet count. Lymphopenia, it is also called lymphocytopenia, is a condition where blood does not have enough lymphocytes. And leukopenia, it is a condition of low white blood cell, or WBC count. Also due to viral destructive action, the viral replication increases leading to cellular destruction, causing muscle weakness or myalgia. Above changes in blood cell production and cellular destruction compromises the immune system of the human body and making the individual high risk for dengue hemorrhagic fever. Now we'll see the fourth and last part of pathophysiology, that is vascular leakage. Due to thrombocytopenia, that is low platelet count, there will be increased capillary fragility. It is condition of rupture of small blood vessels causing petechia. Petechia is pinpoint, round spots that form on the skin caused by bleeding. Epistaxis refers to nasal bleeding and gastrointestinal bleeding. In GI bleeding, patient complain of melena, that is the passage of black, tarry stools. The activation of immune response and production of antibodies in dengue causes release of histamines. The increased level of histamine causes inflammatory response and increased capillary permeability, leading to loss of intravascular proteins, that is increased glomerular permeability and fluids into the interstitial compartment, causing plasma leakage. The severe plasma leakage will cause dengue hemorrhagic fever, that is severe form of dengue fever and life-threatening condition. The increased glomerular permeability and plasma leakage causes increased plasma proteins, leading to urinalysis showing proteinuria and hematuria respectively, causing urinary tract infection in patients. Hope you have understood the pathophysiology of dengue virus, that is, transmission of virus, its entry and replication, immune response and vascular leakage. Now we will move on to the next section of the video, that is signs and symptoms of the dengue fever. The signs and symptoms of dengue fever can be divided into two parts, that is, mild and severe. Firstly, we will look into the signs and symptoms of mild dengue fever. In mild dengue fever, the patients will present with sudden onset of high fever, severe headaches, pain behind the eyes, severe joint and muscle pain, fatigue or weakness, nausea and vomiting, skin rashes, etc. In severe dengue, which is also called as dengue hemorrhagic fever or dengue shock syndrome, the patient will present with all the symptoms of mild dengue fever and in addition will present with following signs and symptoms like severe abdominal pain, persistent vomiting, rapid breathing, bleeding gums, blood in vomit or stool, fatigue and restlessness, cold or clammy skin, and shock, that is hypotension. Hope now you can differentiate between mild and severe dengue fever from its signs and symptoms. Now let's see what is the treatment and management of dengue fever. At present, specific treatment for dengue fever is not yet available, hence, the following supportive care and symptomatic treatment is followed as per the patient's condition. Hydration. Monitoring hydration of dengue patients is very important. Patients will be advised oral rehydration or intravenous fluids to prevent dehydration. Intravenous fluid administration is considered mandatory in cases of shock, severe vomiting, and prostration or severe weakness. Crystalloid IV fluids, that is, normal saline, Ringer lactate, and 5% dextrose, make up the first-line treatment choice of intravenous fluid. Pain relief. To relieve the pain and to provide some comfort to the patient, the antipyretic therapy with paracetamol or acetaminophen can be used during the febrile phase. Non-steroid anti-inflammatory drugs like ibuprofen and aspirin should be avoided in case of dengue infections. Transfusion of blood. Patients with major concern of bleeding and having low platelet count must be managed by transfusion of fresh whole blood. For patients with severe dengue, hospitalization is required to manage complications such as shock, bleeding, and organ impairment. Vaccination. Dengue vaccines such as Dengvaxia are available in some countries for the people between the age group of 9 to 45 years. However, the WHO has recommended the vaccine to people who have had previous dengue infection only, as it imposes an increased risk of disease severity in people who get infected with the virus for the first time after their vaccination. Effective management of dengue fever focuses on early detection, supportive care to manage symptoms, and preventing complications through vigilant monitoring. Now, let's move on to the last and most important section of the topic, that is prevention and control of dengue infection. The following preventive measures play important role in prevention and control of dengue infection. Control of mosquito breeding should be done by preventing egg laying in or near stagnant water through environmental modification and management. Proper covering and cleaning of domestic use stored water must be done regularly. Mosquito repellents, insecticides, coils, vaporizers, oils, window screens, mosquito nets, etc. must be used to prevent mosquito bites. Clothes that do not expose too much skin must be worn in areas with a higher risk of dengue infections. Education and awareness programs should be conducted for people and communities that provide awareness and information to them about the causes, clinical symptoms, treatment, prevention and control of the dengue disease. So, in this video you have learnt about what is dengue fever, causes for dengue fever, epidemiology of dengue fever, pathophysiology of dengue fever, signs and symptoms of dengue fever, treatment and management of dengue fever, and prevention and control of dengue fever. Hope you have understood all the section very well. Thank you for watching my video on dengue fever, as it is an informative and educative video, useful for all age groups and students. Share it with your friends and family to spread the awareness on dengue fever. And lastly, don't forget to like and subscribe to our channel for more such videos. Hope this was helpful to you. This side Adhya, signing off for today. Namaskar, stay safe and healthy.